Dear friend, let me ask you something important. Have you heard that Medicare is changing in 2026? Has anyone clearly explained what that really means for you and your future? Will your medical costs go up? Will your benefits be reduced? Could you be losing money without even realizing it? Here is the truth. Millions of seniors will be affected by these changes, yet many will not hear about them until it is too late. And today, I am here to make sure you are not one of them. In the next 15 minutes, I will explain what is changing in Medicare in 2026, how it may affect your health and your finances, and what smart seniors must do right now to stay protected. No confusion, no scare tactics, just clear, honest truth. So stay with me till the end, because one of these changes could save you thousands of dollars. Let's begin. Before we talk about the specific changes coming in 2026, let's first understand why these changes are happening. Every single year, more Americans are reaching the age of 65 and becoming eligible for Medicare. This means more seniors are using healthcare services, more doctor visits, more hospital stays, more medications, and more treatments. And as medical care increases, government spending also increases. At the same time, prescription drug prices continue to rise. Many seniors have struggled for years to afford their medications. Some have paid hundreds of dollars every month. Others have been forced to skip important medicine because of high costs. Because of this, the government is trying to do three main things: control healthcare costs, protect seniors from financial hardship, and improve access to quality medical care. That is why Medicare rules are reviewed and updated regularly. But 2026 stands out as one of the biggest update years in recent history. Some of these changes will be helpful, some may bring new challenges, and some will depend on how well prepared you are. Now let's talk about one of the most important updates: prescription drugs under Part D. In 2026, Medicare will introduce stronger limits on how much seniors can spend on prescription medicine in a year. This means fewer surprise bills, more financial protection, and better control over monthly expenses. For many seniors, this will bring real peace of mind at the pharmacy. However, there is also a catch. To balance these new protections, insurance companies may adjust their plans. Some premiums may increase, some drug lists may change, and some coverage rules may be updated. So while you may save money in one area, you could pay more in another. That is why carefully reviewing your Part D plan in 2026 will be more important than ever before. Now let's talk about Medicare Advantage, also known as Part C. Over the past several years, Part C has become more popular than ever before. Today, more than half of all seniors in the United States are enrolled in Medicare Advantage plans. Many people choose these plans because they offer low monthly premiums, combined coverage, and extra benefits like dental, vision, and hearing care. Because so many seniors now depend on these plans, Medicare is paying closer attention to how they operate. In 2026, new rules will be introduced to improve fairness and transparency. Insurance companies will be required to be more honest and clear about what their plans really cover. Advertising rules will become stricter, so seniors are less likely to be misled by confusing or exaggerated promises. Benefit details must be explained more clearly, and denials of care will be monitored more closely to protect patients. This is very good news. It means fewer misleading advertisements, fewer hidden rules, and stronger protection for seniors. Many people will feel more confident about choosing and using their Medicare Advantage plans. However, there is another side to this story. Stricter rules also mean higher operating costs for insurance companies. To balance these new expenses, some companies may make changes to their plans. This could include reducing certain benefits, changing doctor and hospital networks, limiting access to some services, or adjusting coverage rules. In some cases, part of these costs may be passed on to seniors through higher co-payments, new restrictions, or reduced flexibility. That is why, if you are enrolled in a Medicare Advantage plan, 2026 is not a year to relax and ignore your coverage. It is a year to pay close attention, review your plan carefully, check your doctors, confirm your hospitals, review your medications. Staying informed will help you avoid surprises and protect your health and finances. Now let's talk about something that affects every single person on Medicare: money. No matter how healthy you are, healthcare costs matter. They affect your savings, your monthly budget, and your peace of mind. That is why it is important to understand how Medicare costs may change in 2026. In 2026, several parts of Medicare may see adjustments, including monthly premiums, yearly deductibles, co-payments, and out-of-pocket limits. Part B premiums may increase, annual deductibles may be adjusted, limits on how much you pay in a year could shift. These types of changes happen almost every year, but during major reform periods, they are often more noticeable. Some seniors will see their costs go up. Others may see their costs go down, and some may notice little or no change at all. It all depends on your personal situation. Your income plays a role because higher earners usually pay higher premiums. Your specific plan also matters because different insurance companies set different prices. Your location can affect costs, since healthcare prices vary by region. And of course, your health needs matter, because people who use more medical services often pay more overall. That is why you should never assume that your Medicare costs will stay the same from year to year. A plan that was affordable last year may become more expensive this year. A plan that once fit your needs may no longer be the best option. Smart seniors make it a habit to check their costs regularly. They review their premiums, they study their deductibles, they compare co-payments, they look at out-of-pocket limits. Taking time to review and compare plans each year can help you avoid unpleasant surprises and keep more of your hard-earned money. Remember, when it comes to Medicare, staying informed is one of the best ways to protect your financial future. Now here is some good news that many seniors will be happy to hear. In 2026, Medicare is expanding access to healthcare services, making it easier for older adults to receive the care they need without unnecessary stress or travel. More preventive services, more health screenings, more wellness programs, and more telehealth visits will be available under many plans. Preventive care helps doctors find problems early, before they become serious. Screenings can detect illnesses like cancer, heart disease, and diabetes in their early stages. Wellness programs support healthy living and better daily habits. And telehealth allows you to speak with a doctor from the comfort of your own home using a phone, tablet, or computer. This means that many seniors may now be able to see their doctors without leaving home, receive earlier diagnoses, avoid unnecessary hospital stays, and manage chronic conditions more effectively. For seniors who live far from hospitals, no longer drive or have mobility challenges, these improvements can be a true blessing. They save time, reduce stress, and improve quality of life. However, it is important to remember that not all Medicare plans offer the same telehealth and preventive benefits. Some plans provide wide access, while others have limits or special rules. That is why you must always ask questions, check your coverage details, and confirm what services are included in your plan. Knowing what is available to you helps you take full advantage of these valuable benefits and stay healthier for longer. Now let's talk about something most seniors rarely hear about, but which has a big impact on their healthcare. Medicare plan ratings. Every year, Medicare carefully evaluates and rates insurance plans based on how well they serve their members. These ratings look at many factors, including customer service, how quickly claims are processed, how easy it is to get appointments, how well chronic conditions are managed, and how satisfied members are with their care. In 2026, these ratings will become more important than ever. Plans that consistently provide poor service, deny care unfairly, or fail to meet quality standards may lose funding or face penalties. On the other hand, plans that offer excellent service, clear communication, and reliable coverage may receive additional support and be able to offer better benefits. For seniors, this is good news. It means better customer service, faster processing of medical claims, fewer billing problems, and more dependable coverage. It also encourages insurance companies to treat members with respect and fairness. However, there is another side to this change. Some weaker plans that fail to meet quality standards may be forced to reduce benefits, merge with other plans, or even leave the market entirely. If this happens, you may be required to switch to a different plan, even if you were satisfied with your current one. That is why it is very important not to ignore letters, emails, or notices from Medicare or your insurance company. Always read them carefully. They may contain important updates, warnings, or instructions that affect your coverage, your doctors, and your costs. Staying informed helps you stay protected. Now let me share the most important part of this entire video. Everything you have learned so far will only help you if you take action. So the big question is, what should you do now? Here are 5 smart steps that wise and informed seniors follow to protect their health and their money. First, review your Medicare plan every single year. Never assume that the plan you chose last year is still the best one for you today. Prices change, benefits change, doctor networks change, drug lists change. A better option may now be available, or your current plan may no longer fit your needs. Second, carefully check your medications. Look at every prescription you take and confirm that it is still covered by your plan. Make sure the co-payments are reasonable and that there are no new restrictions. A small change in drug coverage can cost you hundreds of dollars over time. Third, confirm that your doctors and hospitals are still in your plan's network. Many seniors are shocked to discover that their long-time doctor is no longer covered. Checking this in advance can save you from having to switch doctors or pay high out-of-pocket costs. Fourth, pay close attention to enrollment dates. Medicare has strict deadlines for signing up, changing plans, and adding coverage. Missing these deadlines can result in late penalties that last for the rest of your life. Mark important dates on your calendar and never ignore enrollment notices. Fifth, do not be afraid to ask for help. Many seniors try to handle everything alone and become overwhelmed. But you do not have to. Trained counselors, trusted advisors, and Medicare support offices exist to guide you. Using these resources is not a sign of weakness, it is a sign of wisdom. Smart seniors ask questions, seek guidance, and make informed decisions. And that is how they stay protected, confident, and in control of their future. Now let me warn you about some serious dangers that many seniors may face in 2026. As Medicare changes take effect, more companies and marketers will try to take advantage of confusion and fear. You may begin to see more aggressive advertisements on television, online, and in the mail. You may receive more phone calls from people claiming to help you. You may hear promises that sound perfect, but are not fully explained. And you may see more offers promoting so-called $0 plans that hide important details. These traps are designed to make you act quickly without thinking. That is why you must be careful. If something sounds too good to be true, it probably is. Never sign up for any plan without carefully reading the full details. Never give your Medicare number, Social Security number, or bank information to strangers who contact you unexpectedly. Legitimate Medicare representatives will never pressure you to make fast decisions over the phone. Also, never rush important healthcare choices because of fear or excitement. Your health is too valuable for rushed decisions. Take time to compare options. Ask trusted family members for advice. Speak with licensed counselors. Verify information before agreeing to anything. Patience protects you from costly mistakes. When you move slowly and wisely, you protect your money, your health, and your peace of mind. Dear friend, Medicare is changing, but that does not mean you should be afraid. It means you should be informed and prepared. Smart seniors protect their health, save money, and take control of their future. Take time to understand your benefits and review your options. If this video helped you, please like, subscribe to 60 Pose Wisdom and Wellness Hub, and turn on notifications. Comment 2026 for more updates. Remember, growing older means growing wiser. Stay healthy, stay strong, and stay informed.